Today, we catch up with Vanessa, a registered nurse who has been working in Los Angeles County for 10 years. She is also a longtime host of Radio Clash on KUCR. Glad to have you on the show again, Vanessa.
Thanks for having me, Elliot.
So, Vanessa, why is the vaccine important?
Well, I think since the last time we've been on, unfortunately, I would have hoped things would have gotten better, but especially starting in November, we've had an increase in hospitals. We still have COVID that's in our communities. So having the vaccine come out is a big step forward. So I think it's really important for those in our communities to get really good information. And I know that there's a lot of misinformation out there, but this is just a step in, actually a tool in our toolbox to try to minimize COVID and try to move on so we can get back to some sort of normalcy.
And you've taken the first and second dose of the COVID vaccine. What was that experience like?
So we were offered the COVID vaccine at my hospital in mid-December, and I've gotten both doses. And to be honest, I'm sure everybody out there, initially I was wary about it. Initially, I wasn't sure. I felt like maybe it was coming out fast, and I had to do a little bit more research it on myself. But I think what really hit me and what it's hitting a lot of people is my mom got sick, my dad got sick, my sister got sick. And when it hits close to home, I just felt like I need to do something to protect myself, to protect my family, and to protect the patients that I work with in my community. A lot of Latinos, um, African American, Asian, a lot of minority communities are really hitting hard from this pandemic because they're essential workers, or for whatever reason they contract COVID, and right now it's really, we're seeing a lot of deaths. So after all that, putting it together and doing my own research from credible websites, I just thought, you know what, I need to get this vaccine. So the first dose, I got it. And so far I was okay. I was sore. They tell you a list of some of the potential side effects. Um, so I did have a sore arm and kind of restless that night. I have my other coworkers were also talking about, some of the symptoms that they felt, restless, maybe chills at night, that tiredness for a while. Um, but I was okay. And then I got my second dose and I did the same thing. I just kind of took a Tylenol for my sore arm and something to help me kind of sleep at night. But overall, I just been really lucky. I haven't had very much side effects from it. And even a lot of my coworkers who do have some side effects, it just kind of minimized after a couple days.
Cool, cool. So, finally, any health tips?
Yeah, you know what? I know in the news the hospitals were full. So as much as you can, I mean, we want you to follow the basics of COVID with wearing your mask, washing your hands. If you do contract it and you're able to stay at home, we recommend just staying hydrated, rest. You know, um, this is just health tips, but it we recommend like taking your vitamin C, vitamin D, zinc, and we actually give those to our COVID patients in the hospital too. So if you can just do that and monitor your temperature at home, that's always a good thing. And if you're able to get the vaccine, I know we're trying to roll it out, but even when you get the vaccine, and even for myself having both doses, we still need to social distance, wear mask, and all the foundations of what we've been doing all along, because the vaccine, just because you got it doesn't mean you could go back to normal. We're still having to do all our precautions. And that's what I'm doing still too, even with the vaccine.
Cool. Well, thank you, Vanessa. Thank you for giving us some good tips, and I'll hope to see you again soon.
Yeah, take care of yourself, Elliot. Thank you.